Hi everybody and welcome to this latest edition of Chrysalis on the Couch. I'm really pleased to say that I'm joined today by Sue and Cila, two tutors with Chrysalis, and we're going to be discussing integrative practice today. If you enjoy the video, please remember to like and subscribe to the Chrysalis channel and take a look at some other Chrysalis on the Couch episodes where we chat about a wide variety of things. So today really was sparked by the questions that will sometimes get asked, like, are you a counsellor or are you a hypnotherapist? Can you be both? How do you know which techniques to use? And things like that. So we really hope to kind of discuss and answer some of those questions today. And hopefully that'll be interesting for everybody watching. So thanks so much for joining us. My name's Joanna. If you haven't come across me before, I'm a year one tutor for Chrysalis and have been for a few years now. And I'm going to ask my colleagues to introduce themselves and tell us a bit about them and where they are. So Sue, can I start with you?
So hi, I'm Sue. I teach year one for Chrysalis in Nottingham. I've been doing that for 5 or 6 years now, I think. I'm a hypnotherapist in private practice. I'm also a counsellor in private practice, and I'm also a supervisor in private practice, just to, not run out of things to do.
Yeah, absolutely. You weren't busy enough, so you thought you'd do that as well. Fantastic. Great stuff. Welcome, Sue. It's really nice to meet you in person as well today. And Cila.
Hello, my name is Cila. I teach at Chrysalis. I teach in London. I'm also working as an integrative psychotherapist, a clinical psychotherapist. And so I started off as a hypnotherapist, and then my training went on to be more leaning towards cognitive behavior therapy, and as well as an integrative psychotherapy.
Brilliant. So
you
a whole range of techniques. I'm delighted. That means we've got the right person today to talk about this subject. The right people. All of us have got a varied workload. So Cila, you started as a hypnotherapist. Is that right? That was the beginning of your training. So that was sort of what you wanted to do originally.
It was pretty much my bread and butter as a start-off point, and I did very, very well out of it. But then the more different types of clients I got, the more the deeper rooted issues I was having to deal with. Yeah. And as a result, I then developed an interest into training myself constantly, and I ended up constantly training.
I see. Yeah.
And as a result, I ended up with quite a lot of qualifications, and but as a result, now I've got quite a wide range of toolkits, which I can use in a therapy room alongside with hypnosis.
Yeah, perfect. Because obviously every client is different, so they all need different things, don't they?
And everybody's a different individual, and there's no such thing as one fits all. No. So some people respond very, very well for hypnosis, whereas others don't, or they can't be hypnotized, or they shouldn't. And as a result, you would need to, in order to help them, you need to have a different approach. Yeah. So it's good to know a lot of different types.
Yeah, I have a lot of options. I suppose I asked you about where you started because I think, did you train with Chrysalis or?
I did, yes.
Oh, okay. I think Sue did as well, and I did. Yeah,
I did.
So one of the, I don't know about you guys, one of the questions I ask my students on in the first class, and I was asked it as a student when I began, was who's here to learn hypnotherapy and who's here because they want to do counselling, and actually they just sort of have to do hypnotherapy year one and they're not really quite sure, they don't know anything about it. And you always get a really interesting response in the room. I think it's good to get that out in the open up front.
Yeah.
And I never intended to be a practicing hypnotherapist, really. So you're shaking your head, were you the same?
Absolutely.
Yeah.
not even sure it was a real thing when I signed up.
Really? Oh my
Yep.
goodness. Yeah. And we have students in that position, don't we? Definitely. Yeah.
Yeah.
Maybe students watching this video would be like, yeah, hypnosis, what's that? You know.
Absolutely. And I think it really helps on day one as a student if you've got reservations about what is this hypnosis stuff, and really, do I have to do it to get to the counselling? To have your tutor say, well, I was in the same position, and I don't need everyone in a year one class to necessarily fall in love with hypnosis and be a hypnotherapist, but the understanding that you get, even if you don't want to use it, the understanding that you get into how to tailor therapy to a client and how the mind works and just the building blocks of therapy is fantastic. And you might do a me and fall in love with it at the same time. So,
well, that's very true, because if you think of Freud itself originally, I mean, he what did he actually do? He was lying people on his couch, right? So they got into this extremely nice and relaxed state. They closed their eyes, and then they were in this relaxed state, and then they started talking. Right. And then they went into all different types of part of their lives, back into childhood, talk about mom, talk about dad, even remembering intricate details that they wouldn't be able to recall as they were talking without lying on his couch. What he really was doing, if you really think about it, he was using more of the alpha state of mind to elicit information from his patients. And if you think of Freud itself, he was, if you look, I mean, I don't know if anybody had any sort of Freudian training, but he was already influenced by a chap called Charcot. And when he was young, so the young Freud was quite influenced by Charcot, and Charcot was a Mesmer's student. So you can see how it developed. Charcot's taking stuff of Mesmer, and Mesmer and Charcot, they were both hypnotherapists. So it's just really interesting how Freud was already using it, but not calling it hypnotherapy. He was just calling it psychotherapy.
It is really, thank you for raising that, because it's so interesting that actually when we think that modern psychotherapy has its history in hypnotherapy, then it's right that the training we do follows that path as well in lots of ways, doesn't it? It kind of starts you with we start with people like Mesmer, and we go, right, this is the history of hypnotherapy. So I think a lot of people wouldn't really realize that, because their associations with the practice would be quite different and might be quite showbiz. And as you say, Sue, it's really good to get those like misconceptions out of the way early doors, isn't it? Because our clients have them too, don't they, sometimes? Even if they come for hypnotherapy, they still might have reservations. So we have to be really on top of those things. So we all do some counselling, some hypnotherapy, some other things, CBT, whatever techniques it might be that we use. How do we, so one of the things I always say, students often ask me, which do you use most, or what do people come to you for? Do you use both sometimes? And I find a client comes to me often for one or the other, because I advertise quite clearly that I'm a counsellor and I'm a hypnotherapist. The client comes to us for one or the other, but it's never just one or the other, is it? So how can we express, how do we put into words how we integrate those two practices? How would you explain it to students in training?
It depends.
What do you think?
Depends. I mean, myself, I'm a clinical therapist. So when my clients approach me with whatever their presenting issue is, and then they often come in and they often say, hi, I've got a presentation anxiety, and I'd like you to hypnotize me and take it away.
Yes. me.
Yeah, fix
Wave
me.
your
You
magic
fix
wand.
me.
Magic wand.
I don't want to do anything about it. I want you to help me.
Yeah.
So yeah. So at that point, but me as I'm a clinical therapist. So as a clinical therapist, we don't let clients decide what they're going to have. So we gently we assess the client, and then we would then tell the client, according to our assessment, that this is what we assessed you for, and these are the alternatives, these are the best course of actions to use, and then we collaboratively make a decision with the client as to what course of action we will be taking. And it's not always hypnotherapy. So then, but as a cognitive therapist, we tend to integrate hypnosis in something called towards the end of the therapy. So we look into the issue itself. We look into the thoughts, the beliefs behind it, and then we help the client change their debilitating negative beliefs. And then once it's done, then we can integrate the hypnosis part into it for the person to be easily remember it, and then as a result they change their behavior by default.
Yeah. So what you're doing with the hypnosis at that point is you're trying to embed a deep level.
Yeah,
those
that's right. Yeah. So we use that in the integration part. We call it integration part, which is still on session 5 or 6 or whatever. We don't always start with it.
Yeah, it's really interesting, isn't it, to understand that,
like hammering it into people's heads. This is what you learned. Now you will remember. Like it or not, you will remember.
Yeah, absolutely. And that's really interesting, because I sometimes, the question of when to use hypnosis in a course of treatment is very interesting to me, because again, it's individual, isn't it? But
yeah,
I'm fascinated to hear that you use it in the end in that way. It makes a lot of sense to me. What would your approach be, Sue? Generally, it's hard to generalize.
I must admit, I tend to use it towards the end if I'm integrating it into a counselling setting.
Yes.
Because I think there are some things that a client will come and they'll go, this is my issue, and it's, I don't know, like Cila was saying, if they've got performance anxiety or something, that's tailor-made for hypnosis, and I'd suggest hypnosis from day one for that.
Yeah.
But if you're dealing with a less obvious issue, or with deeper roots or complications, then sometimes you need to talk around it for a while before you can actually identify what's underneath it and what's going on and what the source of the issues are. And I mean, sometimes with some really complex counselling work, I might be seeing someone for 6 months or so, and then feel I've got enough information now. 1 or 2 hypnosis sessions would be amazingly useful here, so we'll implement that, and the response from the client is phenomenal, because they've done the work, they've prepared the ground, if you use a gardening kind of metaphor, which we do quite a lot in hypnosis.
Yeah,
I do like a gardening metaphor.
Ericksonian of you.
Very.
I guess.
Sorry, no, I was just going to say, and you've done all that preparation, and then you just go and pop in the hypnosis session, and because the client's ready for it, it can be quite dramatic sometimes, the change just off the back of 1, maybe 2 sessions, because you've done all that preparation work already.
I guess there's no such a thing as a hard and fast rule as to when to use it, and whether or not you are a hypnotherapist, you're a counsellor, you're a CBT therapist, you're this, you're that. So it's probably easier or more helpful to remove the labels and then just look at the client and the issue, and treat the client and the issue itself. So, for example, I had a client who was presenting with depression, but in the meantime he had bruxism, because he had that depression and anxiety all together due to post-traumatic stress. So it's lovely, very nice, complex client. That's right. So I started with him with hypnosis for the bruxism, because his bruxism which was the involuntary clenching of its jaw, was in a way of the therapy. So because he was so anxious, they was constantly clenching his jaw, gave him a lot of pain. So the guy was in pain, he woke up with pain. So we started with that immediately. So that was session 1 on bruxism, worked immediately. So then, because bruxism was in a way of the therapy, we got rid of it quickly. And then we started off treating his anxiety, his depression, and then we went into later on the PTSD. So it depends. I think it depends on when you use the stuff. It depends on the presenting issue and the client.
That's a really good point, and that's so interesting to hear that it can be useful at the very beginning as well, because I think sometimes as well it can work. Doing some hypnosis early on can work as like a convincer for a client, especially on something like that is more of a, if you like, a symptom. I often find with anxiety, which can be quite complex, many layered work, can't it, where you really want to work on the cause and the symptoms ideally. But I often find if I can help with a symptom to begin with, and they can see quite quick results from maybe a bit of hypnotherapy, it brings them into the counselling space, as you say, Cila, to be able to explore that more fully, because they've gone, oh, this therapy stuff works. Interesting. Maybe there is a magic wand. No, but
when the symptom is gets in a way of the therapy.
Exactly. And then it's really important to sort of get that out of the way if you can, isn't it? And we've got a great tool for that, actually. So yeah, I love what you said about labels as well. And I was thinking that right from the beginning when I was talking about, oh, I'm a hypnotherapist, I'm a counsellor. And actually, you're totally right. I should be, I'm a therapist. And here's my toolkit, shouldn't it?
Yeah.
That's interesting. I might have to rebrand myself.
Because everybody's a different individual, and there's no such a thing as one fits all. No. Some people respond really well for hypnosis, whereas others can't be others cannot be hypnotized at all, such as people with psychosis, or so it's not a good idea to put them on that. And as a result, you would need to have a different approach to be able to help that person to make some progress. So there's no such thing as one fits all. So it's good to have different tools.
I think as well, when we think about integrative practice, do we, one of the questions I ask myself sometimes is, it must be always focused on the clients, but do we sometimes go towards I suppose the stuff we enjoy? Do our own preferences come into account? Do we sometimes fall into that trap of wanting, I know we try not to as professionals, but I wonder if there's sometimes a tendency in us to say, oh, well, I like this approach and I would enjoy this approach as a client and I feel comfortable in this approach. So my tendency goes that way. Does that ever happen? I don't know if I'm expressing that very well. Sue, is that something that you would find funny?
Yeah, I think certainly there is the potential for that to happen. And I think it's really important to work in a very self-reflective way, so that you notice if you start to do things like that. And if you notice that your go-to is always a certain area, if that's appropriate and it's working for the client, then it's not a problem.
Yeah, absolutely.
But it's just worth asking that question, why am I doing this? Is it because it's a good generic starting point, like using a PMR as your induction for hypnosis? I always use a PMR.
Best time,
not necessarily because I like doing them, but because they're relaxing for the client. And in our society, a bit of relaxation goes a long way. So why would you not? Not everyone takes to them, so it's important to have other options in your hypnosis toolkit.
Yeah.
But I notice I always use a PMR.
Yeah. So.
And I go, yeah, okay, that's appropriate. That's fine. It's not a problem. But if there's something else, it's like, am I always going to that first? It's like, is that my preference, or is it because it's a generic starting point, and we'll change it if it doesn't suit the client? So I think it's always good to be self-reflective, just so that you notice what you're doing.
I do as well. So I think for the students learning as well on this course, I think the Chrysalis course is really great in terms of giving a very broad sweep of like a sort of a toolkit and a bit about lots of different techniques and approaches. And it's interesting to watch students on that journey, isn't it, to see them, observe them decide which way they want to go, or feel that they need to specialize in one area or another, because people do have natural affinities for one style or the other, possibly, don't they? And yes, reflecting on that is interesting.
Yeah,
I wonder if it's eclectic or integrative.
That's a good question.
Yeah, because whether we have made a difference between the two. Eclectic. So being an eclectic therapist would be someone who's borrowing tools on a whim,
yes,
from here and there, whereas an integrative therapist would be following a bias, a therapeutic bias to their own preferred therapeutic approach, and then would be integrating another tool at the right point of the therapy. Yeah,
I think that's where I would say I quite openly say that I would call myself a person-centered therapist with an integrative approach, borrowing those tools as they go, but with that person-centered core, I suppose. I guess that's where I would sit in that. But you felt slightly differently, Cila, about you said you're more of a CBT.
Yeah, I prefer the cognitive therapeutic methods, purely because I'm more goal orientated and also more evidence based.
Yeah.
So, but as a result, I studied quite a lot of different types of cognitive approaches. And what I find, for example, when it comes to hypnosis, you've got something called ACT, which is acceptance and commitment based therapy. And in there you've got hypnosis throughout, all the way through. So I'm finding this quite interesting, that you can use whatever therapeutic modality you use. I think hypnosis can be used in just about everywhere.
Yeah, I do as well, actually. They're not in conflict, are they? It's a tool that you can use. What do you find with regard to that, Sue? Do you find, how are you sitting on the kind of cognitive, person-centered?
I think I'm slap in the middle, to be honest. And it's interesting because I noticed, as I've been through my therapy training, that my preferences as a therapist are very different to my preferences as a client.
Oh, that is interesting. Okay.
Yeah, and it took me a while to figure that out. And I almost have two little me's sitting on each shoulder throughout any kind of therapy conversation or debate or work, and one's a client and one's a therapist. And it can get quite crowded in my head sometimes. But I've got a supervisor in there now as well.
Very busy, isn't it?
Oh yeah. But I think my awareness of me as a client and how I like to work, and me as a therapist and how I like to work, the contrast there, I think, gives me a real bonus in a way as a therapist, because I've got both perspectives, within myself.
Yeah.
And interestingly, as a client, I have experienced person-centered counsellors and CBT counsellors, and I didn't quite didn't feel that either fitted well for me. And then I experienced some fantastic counselling that was quite full on, and she highlighted and she pulled at threads, and which is very much not what you'd traditionally do in person-centered, but it worked so well for me. And I was talking that through with my supervisor, and she said, well, if you think about it, that's truly person-centered, because she saw what you needed.
Yes.
And I was like, oh, that's really, really true.
Yeah. What did she do?
So she said that, you know, with the counsellor who I really got the best work done with, she would be quite challenging, and she'd pull on threads, and she'd make connections. Yeah. And my supervisor pointed out to me that was really person-centered of her. And it's not the way that person-centered is presented, but it's actually really true. And and it really changed the way that I look at what kind of therapist I am.
That's interesting.
So I've become a lot more at home with person-centered in that way. And I just look at the client now and go, okay, what do you need?
Yeah.
And that extends to what kind of counselling do you need, but also, am I applying hypnotherapy know-how, whether it's formal hypnosis or just the know-how?
And that's so interesting points there. Thanks, Sue. And that's a really good point about the know-how. As you were talking, I was thinking about matching our clients and coming to where they are and all that sort of behavior that we all do, and recognizing what they need, and sometimes being more direct actually is what they need. But yeah, that's fascinating about applying hypnotherapy know-how and not necessarily hypnosis techniques. Because I don't know about you guys, we probably still are in this situation, aren't we, where do you meet some resistance sometimes if you even mention hypnosis to a client? What do things people say, Cila? What things?
What do you mean in terms of resistance to hypnosis?
The idea of trying hypnosis as part of their treatment, if you like.
So when I see resistance, I work with it. So I go straight into it.
Yeah.
I find out what's the resistance, because that's where the issue is.
That's where the interesting stuff is.
Now, well, that's the problem.
Yeah.
So that's where the problem actually presents itself. So the client might be thinking, oh, I've got a bit of an anxiety issue, or I'm depressed. Okay, so and then shall we do this? Shall we do? No, that's not going to work. No, I don't want that. Let's go into that.
Yes.
So where the obstacles are. So this is the way I see things, and that's how I work. That when I see resistance, we go straight into that, unpack it, because that's going to be the obstacle to change.
Yeah.
And we just unpack that and work with that, name it and address it immediately.
Absolutely. When we teach the module on resistance, can I just come straight to you, Cila, because you just described it beautifully, like how we work with resistance. I'm always trying to articulate that with students about, you know, bringing it in the room and working with it, and you articulated that so much better than I think I ever have, so thank you. I wish, well, this is recorded, right, so I can just play your video after and tell them. So I think that's so true. And I think sometimes that's why it's appropriate to use you know, as well as obviously going to the resistance, to use techniques from hypnotherapy that aren't necessarily, as we've said, like the classic PMR, the standard approach as well. It's how can we adapt and make and use the right things. I had a client recently presenting with anxiety where I was very like, again, in my head, I'm thinking hypnosis would be great for this particular issue. the client, for various reasons, didn't want to go there. And we did explore that, but I didn't want to press it too much, because it was quite a unique reason, actually, which is fine. But it was sort of thinking about, okay, be a bit creative here. And actually there are aspects of my learning from hypnotherapy that we can still incorporate that's going to be really helpful for them. Even if it's just things like mantras and that whole thing about self-talk, which again, you're getting a bit CBT there as well, about changing the thought patterns. But a bit of technique that I'd learned in terms of, and just a bit of psychoeducation about the subconscious, and doing that in the conscious space around, actually, let's try and retrain a subconscious without necessarily going to the trance space, is another way that I think sometimes at the end of year one, students say, well, I'm probably not going to practice hypnotherapy. And I say, well, that's fine. But actually you will take bits that you've learned forward. And we don't really refer to it much in year 2 and 3, do we? But I think it's really great if students can keep practicing it, actually, on practicing certain bits.
And I think as well, the knowledge of how to word hypnotic suggestions so that they're acceptable to the conscious critical faculty, or CCF as we always call it, because conscious critical faculty is a bit of a mouthful. But you know, the incremental language, you know, am I feeling calm? No. Can I feel calmer? Yes I can, actually. And I wasn't, but now you've said it, I might be. So, you know, bringing in put my teeth back in, incremental language, and focusing on the thing that you are trying to instill, an increased sense of calm, a deeper feeling of relaxation, rather than saying don't feel anxious. You know, whether you're using that in hypnosis or in a conversation, it's still the hypnotherapy basics that you're taking forward. And I think that knowledge and that underpinning is fantastic, because the subconscious is listening, whether you're talking to the conscious or directly to the subconscious is going to hear you anyway, so it's still going to go in.
Absolutely.
You are so right. Sorry, you are absolutely right, Sue. If I may add in here that whatever you tell yourself, so that's why you need to be very careful as to how you talk to yourself, because your body doesn't know anything else. No. So if you say, and that goes back to Aaron Beck's self-talk. So if you tell yourself on a daily basis that, oh, you're useless, oh, you just can't do this, then what's going to happen? You won't be able to do it. You will become used, and you will start acting the way what you are telling yourself. So it's really interesting that you know, even Beck already had identified self-talk. And in hypnosis, in hypnotherapy, we are already changing it. Where when we are talking about confidence and changing self-confidence and strengthening self-confidence. So I'm finding that quite similar on its way. So and then as a result, it's quite interesting and rather easy to integrate the two together.
It is. Beautiful. I'm so glad we got to that place where we just concluded that that's really, really easy. So job done. Thank you. Guys, it's been so great chatting with you today about all of this. And I could chat all day, especially on this subject of self-talk. And maybe that's a whole subject on its own for a next Chrysalis on the Couch, because that's fascinating, isn't it? The language that we use. And it does bring us right into a neat circle, I think. And to your point earlier, Cila, as Sue was just saying, whether we're talking to the conscious mind or we're in trance, you're hearing it, aren't you? Subconscious is hearing it, your body's hearing it, as you say. And to your earlier point right at the start, Celine, you said about Freud and patients on the couch in a form of trance. As our clients come to us in whatever setting, for whatever therapy, with whatever issue they present with, they're in a receptive, hopefully, in quite a receptive state, aren't they? So our language is so important, how we speak to them and the suggestions we present. So we're actually integrating all the time, aren't we? Fascinating. Brilliant. We ought to wrap up there, ladies, but thanks so much for chatting with me this morning. It's been really fun. And I hope that anybody watching the video, and don't forget to like and subscribe to the channel, has enjoyed it too, and it sparked some thoughts and some conversations maybe. So feel free to pop some stuff in the comments if you're watching this and you've got anything to add, because I think we'd really love to hear it. So yeah, I'll wrap it up there, unless either of you've got anything else you want to close with. I think that was a good place to wrap up and let you get on.
Been very nice talking to you. Thank you very much.
It's a pleasure. Thanks so much, guys, and I will see you again. Take care.
Take care.
Bye. Bye.